from other practitioners asking us how we handle deeper skin tones, especially in South Florida. It is sunny all year round.
I think we've come a long way where, now laser companies have, some of them have created Hi everyone, welcome back to the GLANZ Wellness. Thank you for one more time tuning in this week, and we have an amazing topic.
Skin tones, how we treat them specifically with the lasers. It's a hot topic specifically because there are so many horror stories we've heard and received on Linette's side from other practitioners asking us how we handle deeper skin tones, especially in South Florida. It is sunny all year round, and that just makes your skin so much more sensitive. And not all lasers settings work the same for every single skin tone. What leads, well, you can explain it better, but what leads a lot of patients down the wrong path is they get the settings too high and they get burned and whatnot. So it's really important that you go to a practitioner or a med spa that has well-versed experience in all of that. So Dr. Rivera, what do you determine or how do you define skin tone?
So that's a really good point, Sophie. When we talk about lasers, one of the points that we definitely have to figure out and get it right is the patient's skin tone. Skin tone is a scale where you decide what type of how much melanin the patient has. So it's from skin type 1 all the way to 6. So if we kind of like make it so that we can understand a little bit better, right? So skin type 1 is going to be your patient that is redheaded, very light skin tone, white, kind of blue eyes or green eyes, very, very little melanin on their skin. That would be skin type 1. Skin type 2 is mostly your Americans, which they're blonde, but they still have a little bit of pigment, but they're still considered white, very light skin. Skin type 3 is going to be someone that is in between that and a skin type 4, which is, for example, myself. Skin type 4s are any Hispanic patients that have a little bit more melanin, and they are not darker skin tone, but they kind of have like a tan skin. A way that you can ask patients to determine their skin tone is how they tan. If you go to the sun, do you tan and get extremely red, like a skin type 1, 2, or 3? Or do you kind of tan, kind of brownish, kind of like that sun-kissed tone? Anything that is like that or actually tans a little bit darker is 4 and up. For example, in Puerto Rico, we have patients that are blonde, blue eyes. They're still Hispanic, and they still would be considered skin type 4 because they have more melanin than a regular skin type 2. So Indians, for example, are skin type 5, and then African Americans are skin type 6. Again, that is based a lot on the pigmentation and the amount of melanocytes and how big those cells that make pigment, which are called the melanocytes, how big they are and how much melanin they're going to make if, for example, there's an injury, right? If we cut ourselves, are you a person that hyperpigments, or is your skin, it just heals and everything's good? When it comes to treating patients with lasers, you want to ask that question, because if you don't, what can happen is if you hit the skin too much, first you can develop melasma. And if you don't treat it right and you make an injury where the cells are like, okay, this is a lot of stress for the skin, what are we going to do? We're going to throw pigment. So that's where side effects and bad outcomes with hyperpigmentations come around, where you cannot use all lasers on all skin tones. That's not how it works. I feel we've gotten to the point where there's so much advancement in lasers that there's a lot of lasers that can be used on patients skin type 4 or above, but you definitely have to make sure that the settings are right, and you want to make sure you go to a provider that can tell you the settings that you need for what you're treating.
Can you describe your process into how you create the settings for a certain skin tone? You know, skin tone is a huge factor, and not just like laser hair removal here, but it's like even the non-ablative lasers have that risk of, like you said, hyperpigmentation or melasma being a popular side effect. So yeah, explain to us a little bit of your process into when you get a new patient and they're looking for a new laser. What other questions do you ask them?
So first of all is what we want to treat. If we're going to treat, if you kind of think about skin and skin tones, if you think of lighter skin tone patients, they're going to have some pigment from the sun. They don't tend to be more prone to melasma, which is caused by heat, but they do have more wrinkles. Just because the sun can penetrate better on the skin, their skin gets dehydrated and they develop wrinkles. That's how it works. If you think of patients that are darker skin tones, right? So when God made us and you live at a certain part of the equator or the globe, right? If you are more exposed to sun, the way that it works is you want more melanin, because if not, you would be completely burned, right? If you think of Miami versus Puerto Rico, even when we're very similar, Puerto Rico's under heat the entire time. So our skin tone has to be a little bit darker so that we can tolerate the sun and we don't get melanoma and we don't get skin cancer. There's still a risk of cancer because we still have to use SPF, but that's why melanin is there to protect us. So when a patient comes in, I ask them, what do you want to treat? Do you want to treat wrinkles or do you want to treat pigmentation? If you want to treat pigmentation, do you want to treat sun damage or do you want to treat melasma, right? If we think of sun damage, the most popular laser for sun damage is IPL, which is based with light and heat. If I do use that for a patient with melasma, their pigment is going to get worse because you're heating the skin, which is something the melanocytes don't like when it comes to melasma patients. So patients that are lighter skin tones are going to want something more for like sun damage, wrinkles, whereas darker skin tone patients are going to want more for melasma, skin tightening. If you listen to that phrase, black don't crack, it's true. When you see a patient that is a dark skin type 5 or 6, they're not going to have that many wrinkles, but they will have more pigment. So the lasers that I use, you base it on that. I don't want to apply a lot of heat to skin types 4 or above, but I do want something, for example, a Q-switch laser where it breaks the pigment gets better, but it doesn't actually heat the epidermis. If you're talking about treating wrinkles, then you definitely need ablative, right? So you want to completely evaporate the skin. You want to make new skin, so you need some sort of injury where if I use a CO2 laser on a patient that is skin type 5, you can scar them. So the most important thing is what you're treating and do they hyperpigment after getting a cut. And that's what's going to guide you from there.
So when you are a patient of a deeper skin tone or skin tones,
4, 5, or 6.
4, 5, or 6, do you think it's true that they have a longer treatment plan because, let's say, they're using a heat laser and that's like their only option for what they want to treat, that they need to, kind of reduce the time that they're under the laser in order to prevent those side effects from happening?
That depends on the laser. So I think we've come a long way where, now laser companies some of them have created lasers that are for darker skin tones. They are safe. They're very effective in creating skin tightening, creating that remodeling of the skin, that resurfacing that the patients want. When you look at yourself in the mirror and you see big pores and kind of like the texture looks kind of like opaque and dull, there's lasers now that are colorblind and you can use them on any skin tone, but you want to make sure that the provider knows what they're doing, because once the bad things happen, if you get, for example, PIH, which is post-inflammatory hyperpigmentation, where there's so much inflammation, the body doesn't know how to deal with it. So the melanocytes just say, you know what, I'm just going to throw pigment up and I don't care what's happening. If that happens, the skin is gonna heal, it's gonna get better eventually, but it's a very long process.
Yeah.
So, imagine that happening on the face, the patients are gonna get like discouraged, you're trying to cover pigment that was caused by a laser, and it doesn't mean anything can happen with the laser, whether you hyperpigment, whether you use the laser that's correct for you, and we use the perfect settings, there's always a risk involved in anything we do. But the difference is you want to make sure you use lasers that are appropriate for your skin tone. I've had laser reps come to my office and say, yeah, you can use this on any skin tone. But when you actually look, the settings, are they kind of like the same if you treat light skin tone versus darker skin tones? If they're not the same, are the results the same, right? Because if I do a laser here at the office at GLANZ, I want to make sure that you get amazing results. So I try to go as high as I can so that your results are amazing. But if I can't do that with a laser, even if I can treat you with a laser that you can treat any skin tone, if my settings are going to be very, very low, that for me is not worth it.
So what other advancements in laser technology do you think has come such a long way in comparison to the past lasers where people did not know how to treat deeper skin tones without the repercussions of, burns or hyperpigmentation?
I think that's based on the type of laser. So if we talk about laser hair removal, right? So a very common laser hair removal is a YAG laser. So when we talk about the YAG and the Alex, you have to switch hand pieces based on the skin tone that you're treating. For example, we have a laser now called the Soprano. The Soprano has 3 wavelengths. When I'm treating a patient, I put there kind of like what skin tone the patient is, and the device already calculates on its own, okay, this is a person that's skin type 3, this is the settings that I'm gonna have. And it prevents a lot of, bad outcomes for the providers, but at the same time, it's safer for patients. When we talk about, for example, comparing a YAG to that Soprano, there's no pain with a Soprano. Whereas with a YAG, yes, you're gonna undergo pain, and then you're stressed out, am I gonna get burned? You can't, with a YAG, you cannot go outside in the sun. Like we live in Miami, people go here to the beach every day. So Soprano, there's no downtime. You can go to the beach the same day and there's no problem. So those are the advancements in terms of hair removal. So now we have devices that you can safely get treated, but also you're gonna have really, really good results. If we talk about resurfacing, right? Because resurfacing is something that everyone wants to have smooth, beautiful skin and create collagen and kind of prevent wrinkles. So if we talk about, for example, a CO2 laser I might not do on a skin type 4 or above, which I do here. I do skin types 4, but I try to lower my settings in terms of heat. So I have designed a very unique way of being able to do it with minimizing the side effects, because I've done it for so many years. But if we think about now, there's a laser, the plasma device. There's a device which has plasma and radio frequency, not plasma like the blood, but plasma like the state of matter, right? So like the sun or a lightning bulb. So if we look at that device, that was designed by a company called Alma Lasers, and it is completely colorblind. So when you treat the patients, you are resurfacing the skin, but it's not based on what skin tone you are. I still go lower on my energy for patients that are darker skin tones just to be safe. But when you look at the results are very equivalent to having a CO2 laser, but you kind of have to do more treatments, which is, I mean, it is what it is, right?
Yeah.
It's better to get more treatments and be safe and have really good results.
And like,
Yeah.
the fast and easy way is not always like the safest way.
Yes. Yeah. The most appropriate way. I think I always tell patients, you can have the same device with 2 providers, and it doesn't mean you're gonna get the same outcome. You have to, it's like going to a surgeon, right? If you go to a surgeon, The two surgeons went through the same residency, they might have the same liposuction device, but that doesn't mean your results are going to be the same. So a lot of it is based on how much training you go to every year, you know, how much you use these devices, because if there's a provider that uses a CO2 laser once every 3 months, it's not going to be the same as a provider that uses it every single week, and he can see the changes on the skin. So those are things, when you're a patient, you have to make sure that you ask those questions, like, okay, how long have you had this laser? You know, what results am I going to get? Is this safe for my skin tone? Is there another laser that might be better? We talked about this the first episode, right?
Yeah, we did.
If the providers are going to recommend what they have in the office, is that the best for you? You know, is there's a microneedling with radio frequency laser that's super popular out there. Is that the best for me? Yes, it might give me a little bit of skin tightening. Yes, it might stimulate collagen, but is that the best for me? Am I going to get the best results?
Absolutely. And what would you say are the biggest misconceptions of skin tone? Because the big thing I hear a lot is, oh, I'm tan, I don't need to wear sunscreen. Cause
oh my God, yes.
I hear that all the time, and I'm like, and now there's a movement on the internet. Now people are like reprimanding people, you need to wear your sunscreen every single day, which is,
yes.
It should have been like that since the beginning, but that's a huge misconception.
100%. Just because you have more melanin on your skin doesn't mean that you are not getting affected by the UV rays. So not even if you're gonna tan, let's think about skin cancer, right? So the skin cancer incidence is now growing. Yes, we did. I mean, my mom used to use baby oil to go to the beach, and that is something that is not happening now because we're getting a little bit more conscientious. I think the TikTok, social media generation are talking so much about sunscreen and skin protection and using skincare early. But even if you have more melanin, you can still get skin cancer, you can still get melanoma, basal cells, squamous, any of those. But we have to use, and besides the cancer, it's also about how much you're going to dehydrate the skin, right? On melasma, let's talk about melasma. You know, it's so popular on darker skin tones. Everybody needs sunscreen. I sell 1,000 different sunscreens here. There's 1,000 different sunscreens out there. I always recommend for patients to use physical sunscreen, especially on the face. If we talk about sunscreens, right, which we're going to do another episode about sunscreens because we can talk about a lot about them. But if we talk about what a physical sunscreen versus a chemical sunscreen is, you know, physical means that it's completely blocking the UV rays, so they're not penetrating the skin. It's kind of like a helmet. If we talk about chemical sunscreens, the UV rays are gonna penetrate the skin, but they kind of switch into good energy where your skin's not gonna be as affected. So patients, for example, melasma patients that are very, very light skin tones, I tell them use a physical sunscreen. Most physical sunscreens tend to be a little thicker, so not everyone loves them. But for example, if you go to the pharmacy, you're gonna find a lot of them are chemical sunscreens, but those are thinner, right? So if you have melasma, especially melasma patients, you need physical sunscreen. Please, I use physical sunscreen for my face, neck, and décolleté, and then I use chemical for the rest of the body. So I always recommend for patients with melasma, you need physical sunscreen. Sunscreen is, if you ask me what are the two main products for patients, is retinol and sunscreen. And if you ask me the most important one, I will say sunscreen. So then another big misconception is I can do any laser, nothing bad is gonna happen. I think you have to make sure that you go to a good provider that's gonna tell you straight up what your risks are, what possible side effects are, if you're gonna get really good results about it. And that includes lasers, chemical peels, anything. Like I don't know if you saw, there was a patient that was shown on Instagram where he got a chemical peel and his face got completely burned because they didn't, I don't know if you remember, but this was like a year ago. And anything, you want to make sure anything that you get done, like I always say, don't go to your friend that's practicing, I just got this green, you want to try it.
Yeah.
Don't do that. Go to an expert, because especially for your face, like if something happens, you are going to regret it, and we can try to fix it, but it doesn't, that's not always the case. And it's very sad that for you to save a little bit of money, you get all these bad repercussions from just, going to somebody that wasn't an expert on skin tone.
How do you treat patients that have had adverse side effects in the past that still affect them today?
So I am lucky enough to have multiple lasers, as you know. So for example, if a patient has hyperpigmentation from, it could be a chemical peel, it could be, a laser treatment that they had done. We have some treatments here, for example, our Q-switch laser that can help with hyperpigmentation. It goes into different depths of the skin, so I am able to try to fix that. But I mean, and that depends what laser was used. Like anybody, if you do a surgery with somebody random and you get a complication, no surgeon's gonna touch you, right? So for me, I try to help the patients as much as I can, but I will tell you, most of the time, the patients don't even know what laser they have done. They didn't research, they don't know the name, they don't know what settings they use, nothing. So that is very important. If you get a complication, those are things that you have to bring to see how much time we have to wait until we treat you again. What laser we're gonna use. Is this hyperpigmentation versus scarring or some other skin condition that we have to treat? So, I mean, we wanna live in a world where we hope nothing bad happens, but that's not the case. I actually had a patient when I was in Tampa, and this was crazy to me. So he was our patient. He used to get hair removal and Botox with us. This was a male. He had a big birthmark on his shoulder.
Oh, yeah, you told me.
And he went to a dermatologist. So this is the thing. Dermatologist is like plastic surgeons, Not all plastic surgeons are going to be good at their job, the same way not all endocrinologists are going to be good at their job, and not all dermatologists are going to be good at their job. So I love second opinions. Ask the provider to explain what the laser is doing, how it acts on the skin. Let me see before and afters. Let me see, do you get any complications? Ask those questions, like, this is your skin. So the guy goes into a dermatologist. He had a new IPL device, and he treats his birthmark. I honestly don't know what settings they use, but they treated his birthmark and he completely got burned. He had literally stripes of like burned skin.
How big was that birthmark?
It was big. It was like, it came from, it started like at the border of his shoulder all the way almost half his back.
So he wanted to get rid of it.
Yeah.
But with birthmarks, you can't.
No.
No.
Not with IPL, at least. No.
Oh, wow. Okay.
So I don't know if the settings were too high, so he called me like, what can I do? Can I come in? And I was like, I can't do anything right now. You have like a really severe burn. You have to apply antibiotics so that you don't get infected. Make sure you don't go to the gym for a few days because you have literally a burn. Don't pick on the scar, or if you get an ulcer, don't pick on anything, and then apply a bunch of aloe because you have to wait for that to heal.
So once that's healed, then you would say you would start working on it again, but that would take a while.
So I think I think the burn got to a point where, I mean, it ripped his skin. So I don't remember what happened with him, but it was bad. It was bad. And it's something that was preventable. And it's not, I'm not blaming any dermatologist because it's just experience, and that doesn't mean that I'm exempt from side effects.
Yeah.
But the thing is, we always talk about that, right? You want to make sure the provider that talks to you and sees you and treats you knows what to do if you get a complication. And unfortunately, I was like, you have to go to the dermatologist and you have to talk to him to see what you can do about it, because
Yeah.
I can't just, okay, come in and me doing something, you have to wait for it to heal. And you should tell them.
Absolutely. So for people that are going through, because those adverse side effects, like they can affect how you feel.
Of course.
I mean, much more than how you look. But just like, oh my God, I'm like stuck with this. I have to get another $1,000 treatment to fix whatever person did this to me.
Right.
What would you say to those people as word of advice to try to not only not feel hopeless, but also just feel more optimistic about, trying to fix something that a practitioner did that kind of botched their skin?
I mean, there's nothing you can do at this point. You just have to either go to a specialist that can help you try to like regain your skin back. There are a lot of options out there now with the advancements of lasers where we can fix a lot of the things that happen, but don't get discouraged. If it happens, it's happening to a lot of people. It's not only you. It's something that it will get better. You just have to be treated the right way. So for us at the clinic, here we do a laser. We text the patient the next day, what's happening, send me a picture, let me see.
Yeah.
That's why we have our 24-hour messaging system, because for me, I want to know if something is weird and something is happening, I want you to text me. I prefer to say, this is normal, there's nothing happening, there's something happening and I don't know. So if you're going through it, hang in there, just come. I'll be happy to see if I can help with anything that we have here at the clinic, because there's a lot of treatments out there that can help with pigmentation, scarring, whether it is from another treatment or just from like a surgery or things like that. So we always have options. So my motivational quote of the day is, sometimes we look at ourselves in the mirror, and this happens to me too. You look at yourself and you feel like, I don't feel pretty, I have all these wrinkles. I mean, sometimes I come to the clinic and I'm like, oh my God, I need filler, I need Botox, I need a laser, oh my pigment, what am I gonna do? So don't feel like that. The most important thing is, first of all, looking at ourselves as believing that we have so much more to offer than how we look. And there's a lot of things out there that can help how you look and how you feel, but that's not really what's important, right? So my motivational quote, it says, look at yourself in the mirror, smile, and remember God made you special. It doesn't matter how you look, what skin tone you are, if your eyes are green or blue or brown, if you have curly hair or straight hair, those things don't matter. Everything makes you unique, and it makes you very special, not only because God created you like that, but also because you are very different to somebody else. You can change so many things about yourself now, but I wouldn't be happy if I didn't like myself. It doesn't matter if you have lashes or skin treatments or big lips or small lips. Get treatments because it makes you happy, not because you want to look different or you want to look like somebody else. Because for us, the most important thing is how you feel, because that's what's going to make you happy.
Absolutely. And even when people try to look like someone else, like they still can't feel happy sometimes.
Right.
Like even if like they're the epitome of beauty, like they'll still feel like, wait, well, I still need more of this and more of that. Comparison is the thief of joy.
Oh, absolutely. That's
100%,
amazing.
right?
And we look at some of these models or the Kardashians in social media or all that, and we look at them like, oh my God, they're gorgeous, which they are, they're gorgeous,
Yes.
right? But you don't even know if they're even happy. Like what you see on social media is not always what it is. No, social media has created a way of us feeling like our life is very less to somebody else's.
Yes.
And you don't know what's happening behind their doors, and if they're happy, and if they're even happy to be alive, So forget about that. I love social media, but I have looked at it in a very different way, but I'm
Yes.
43, so you know.
Yes, I mean, well, with more things happening, it's like you gain more wisdom and insights like that. So,
Right.
I mean,
Right.
that's like a great insight to have and always think about. And this is your sign to love your skin. And please, if you have anything, it's your skin. Please take care of it, always protect it, and always do your research. And with that, we can finish this episode. Thank you guys so much for tuning in to our episode all about skin tones.
Yes. So if you have more, this was one of our questions from a few weeks ago, which a patient asked, can I get a laser of this sort because I'm skin type 5? So we love your questions. They're good questions. There's no stupid questions. If you think about it, somebody else might be asking what you're asking, and that's why we have this, so that we can answer all your questions. We can get you to feel safe when you go into a place to get a laser treatment or any other aesthetic treatment. So send your questions in, and we'll see you in a week.
Yes. Bye, guys.